The Committee on Health and Welfare will now come in order. We are going to begin as a subcommittee since we do not have enough members here to call roll. And so we will go ahead and start with Senator Coleman on Senate Bill 1168. Chairwoman, we are ready when you are.
Thank you, Senator. Members of the committee, Mary Elizabeth Coleman, representing State Senate District Number 22. This is an identical bill to what we heard with Senator Schor's bill last week. Was just able to get that noticed up, and so the intention is not to belabor the point by repeating all of the points that were made last week. It is an identical Senate committee substitute that has been distributed to the committee as the language that was heard last week, but open to any questions.
Thank you for that, Madam Chairwoman. Do we have any questions from the committee? Seeing none, thank you. Do we have anyone wishing to testify in favor? Please come forward. Be sure to fill out a committee form and
Thank you, Madam Chair, members of the committee. Samuel Lee with Campaign Life Missouri. I want to just go on record in support of Senate Bill 1168. All the testimony we had on Senator Schor's bill applies, and we're in favor and happy to answer any questions.
Thank you, Mr. Lee. Do we have any senators wishing to question this witness? Seeing none, please be sure to leave your form.
Mailed it in.
Excellent. Anyone else here wishing to testify in favor?
Thank you, Madam Chair. Members of the committee, Jamie Morris with the Missouri Catholic Conference here in support. Just want to thank the bill sponsor, and again, was here last week, and gave our testimony at that time. We are in favor of this. Would like to thank the committee for hearing it and for the senator for bringing it forward, and would be happy to answer any questions.
Thank you. Do we have anyone wishing to ask questions of this witness? Seeing none, thank you so much. Anyone else wishing to testify in favor?
Madam Chairman, members of the committee, my name is Patty Skane. I am a registered lobbyist for Missouri Right to Life. We're just here to go on record in support of this bill. And welcome to answer any questions.
Thank you so much. Do we have anyone wishing to ask questions of this witness? Seeing none. Thank you. Please leave your witness form. Anyone else wishing to testify in favor? Anyone wishing to testify against?
Good morning, Michelle Trupiano with Missouri Family Health Council. I know I was here last week, so I don't want to belabor the point, but I do want to just once again really talk about the safety net and the strain that is already under. We periodically, like what we hear is there's plenty of other places for people to go, and so we don't need Planned Parenthood, that people can go to all these other places. We periodically call FQHCs in the same area where Planned Parenthood is. We just called again last week to check on the wait times for new patients. The wait time is an average of 7.5 weeks if it's a new patient trying to get in for a well person exam. Again, the safety net is at capacity, and so if you shut down and put another hole in the safety net, there are not other places for people to go. There's a healthcare shortage throughout the state, and so we just really want to ensure that this committee understands the strain that the safety net is already under, and that we should be doing more to ensure that there are more providers in the network, not fewer providers. Thank you.
Thank you for your testimony. Do we have any senators wishing to question this witness? Seeing none, thank you. Please leave your witness form. Anyone else wishing to testify against? Please come forward. Thank you.
Good morning. My name is Vanessa Welberry. I am the Vice President of Policy and Advocacy at Advocates of Planned Parenthood of the St. Louis region in Southwest Missouri. Here again to emphasize that Missouri's safety net cannot keep up without Planned Parenthood health centers. They provide high quality care, including STI testing and treatment, cancer screenings, well person exams, and the full range of birth control options. I will also say again that nearly 20% of both the Planned Parenthood St. Louis affiliate and the Planned Parenthood Kansas City affiliate of patients rely on Medicaid for their health care coverage. At Planned Parenthood of the St. Louis region, it's actually closer to 25%. Something that wasn't, I don't think, addressed at the last hearing is that Planned Parenthood provides care on evenings and weekends, and there is a clinic in Joplin and in Rolla to talk a little bit about the rural health access. So once again, I will say that any suggestion that patients can go elsewhere is just simply wrong. There aren't enough providers to fill the gap. And the impact is not just on Medicaid patients. A strain on the safety net means a strain in access across the board. And Missourians are already living under an abortion ban. They're living under increasing maternal mortality rates. Those are disproportionately affecting Black women in Missouri. And surging STI rates. So I would just say this policy denies people who rely on publicly funded insurance from using their insurance at trusted healthcare providers like Planned Parenthood. That is what it is about. It is about critical preventive services and our state's safety net. Thank you.
Thank you for that. Do we have anyone wishing to ask a question of this witness? Senator Moon, proceed.
Thank you. Good morning. You mentioned care that wouldn't be provided. What kind of care are you talking about that would not be available to the patients who need care in specifics, if you can?
I'm talking about Planned Parenthood being a critical part of the safety net. So the preventive services safety net, that includes STI screening and testing, that includes birth control. I know a lot of anti-abortion organizations have testified in support of this bill today, but this is not actually about abortion. This is about access to birth control. Well,
and they can
person
only get
exams.
it through your service provider?
Excuse me?
They can only get it through the services that your organization provides?
I did not say that they could only get it. I'm saying that it is a
that's
part
just
of
my
the safety
question. You
net,
said
and it
that
is
they're not going to be able to get it. So
It could increase wait time significantly. As the previous witness said, there already are long wait times at FQHCs, which have been suggested could fill the gap. And so people would be facing longer wait times. We have seen these results in Texas that excluded Planned Parenthood from their safety net in 2011. Increased wait times, and some people who can't find a provider in their communities to get basic contraceptive health care.
I would disagree on some of that, but I'll take you for your word, and thank you for your answer.
Sure. I'll have my colleagues send around the information from Texas after this. It's a pretty recent updated report on some of the impact of that policy.
Anyone else wishing to question the witness? Seeing none, thank you so much. Please leave your witness form. Thank you. Anyone else wishing to testify against? Anyone wishing to testify for informational purposes only? Seeing none, this concludes our hearing on Senate Bill 813. Or, I'm sorry, 1168. I almost nailed being chairwoman this morning. Okay, thank you. I will
Thank
turn
you.
this back over to Chairwoman Coleman.
Thank you, Senator. We now appear to have a quorum, so we're going to go ahead and move out of subcommittee and call the roll. So if you, Madam Secretary, could please call the roll.
Senators Coleman.
Here.
Carter. Here. Arthur. Here. Gannon. Here. Moon. Here. Thompson Rehder. Present. Washington.
With 6 present, we do have a quorum having been established, and there is some senators who need to be in other places this morning, so I'm going to make a motion to move into executive session before we move back to hearing bills. Do I have a second? Thank you, senators. I'm going to make a motion to take up Senate Bill 1168, introduced by myself, which modifies provisions relating to Mo Health Net providers. I make the motion now. Do I have a second? Second. Senator Thompson Rehder seconds. Senate Bill 1168 is now before the committee. Is there any discussion on the bill? Senator?
Yesterday, I received a substitute bill that combined the two, 1168 and 810. This morning, I believe another substitute was submitted, and I didn't have a chance to look that one over. Are there differences between last night's version and this one?
No, Senator, there was a concern. I'm sorry, yes, there was. I apologize. We added the emergency clause to the Senate committee substitute for this morning last week.
Only change.
That's
Okay.
the only
All right.
change is an
Thank you.
emergency clause. Any other questions on the Senate committee substitute ending in .03C? Okay, I move to adopt the committee substitute. Do I have a second? Senator Carter, I kept wanting to just use your first name. Seconds. All those in favor of adopting the committee substitute say aye. Aye. Those opposed say nay. We have adopted the substitute. I now move to vote Senate committee substitute for Senate Bill 1168 and 810 do pass. Do I have a second? Senator Gannon seconds. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Rehder, Washington.
By your vote of 5 to 1, you have voted do pass Senate Bill 1168 and Senate Bill 810. So we're going to move now out of executive session and move back into a regular hearing. Senator Thompson Rehder has two bills. Senate Bill 862 is what we'll start with, modifying provisions relating to money held by the Children's Division for the benefit of a child.
Thank you so much, Madam Chairwoman and members of the committee. I'm Senator Holly Thompson Rehder from Southeast Missouri, and our bill today, Senate Bill 862, deals with our foster care children that are receiving Social Security benefits. So what we have is, and this came to my attention this past May after session had ended, and because of a national movement to make this change. But what we have is the majority of the states actually, that when a child is in the foster system and they receive Social Security benefits, say a parent has passed away and for whatever reason the other parent isn't able to care for them and they're moving to the foster system, the state absorbs their Social Security check. And so what we have is some kids paying for their foster care and some not, right? And when you look at the statistics of children who age out of the foster system, that have no nest egg, that have no form of safety net once they've aged out, that end up in jail for one reason or another, that really don't have that good start in life. Maybe they've been moved to 20 homes over their lifespan. How wonderful for their Social Security benefits to be put in some form of a account for them with guardrails that they could use for future education, to get a technical certificate program to help them with housing. Some of these things that many of us are taught and teach our children, that they've not had the opportunity to have someone that can help them with that. And so what our bill does is it would move that money into an account for these children with guardrails that then they can use once they age out of the system to help give them a little bit of a start for moving forward as an adult. And we've been working with the department, and they've been very helpful in this. We've been working with the national movement, and then also Representative Kelly has the same bill in the House. It received a really good hearing, I believe, last week, and has already been voted out. So I'm happy to answer any questions, and I know that we have some folks that have traveled to testify today.
Thank you, Senator Arthur.
Thank you so much for this legislation, Senator. I read a few articles over the interim about this issue, and then I actually had a constituent reach out, and she'll get to testify today. And before we could even file a bill, we saw that you had one, and so thanks for your work on this. Do you know, I have some questions, but they might be better directed at the Children's Division. Is anyone from the Children's Division here to testify? Okay. So hopefully we'll be able to have conversations with them at some point. But currently, does the department keep records of all the expenditures from these accounts and report on them or provide those records for recipients? Do you know?
I know that was a question that came up in the House hearing.
Yeah.
And I believe that they do, but I don't know that that was accessible in the House hearing. And so I think that that is something that we
gonna work
should
on.
speak with the department about.
Okay. And then when it comes to your legislation, are there any measures or provisions that ensure that there's accountability and that the Children's Division complies?
There is not.
Okay. Okay.
Nope, that's a great question.
I'll be happy to work with you offline, but thanks again for working
Okay,
on this
yes,
issue.
yes, I would
Thanks.
love that.
Any other questions for this for the Senator? Senator Gannon?
Senator Rehder, thank you, and thank you. I had not really ever given this issue a thought.
Same here, right, until I heard about it.
So are you saying that this money would be reserved for certain uses, or would the money just go to this person?
It would be used with some guardrails for
Used with some
certain usage
guardrails.
to help them, right,
Okay, all right,
certain
thank you.
expenses to help them get ahead.
Thank you, I'm in support.
Thank you.
Thank you, Senator. I would just like to say, if there's anyone who's listening from the governor's office, the lack of Children's Division's participation when we have bills affecting them and we need their information is greatly frustrating to the committee, and it's really troublesome. And so I'd expect a visit from the liaison to my office as soon as possible. Thank you.
I did get an email from Taylor this morning that she had another commitment.
Well, sorry for sounding so grumpy then.
I wasn't sure if someone else was going to be here because I know they have been
Like,
very.
the technical stuff is really important, and we often need that information to be able to legislate. So I'm sorry to the
It
governor's
is.
office for my very grumpy statement then. Taylor, come by my office.
They have been
Thanks,
very
Senator.
responsive, and several members have met with me yesterday from different divisions in the department that touch this area, and they were very open and wanting to be helpful and in support.
Perfect. I have some technical questions too with minors and how we're going to be able to put the guardrails on along with accountability. So I think that's going to be a really good addition. I look forward to seeing.
Excellent.
Thank you,
yes.
Senator. Anyone here to testify in support? Go ahead and make sure you've got a witness form filled out and proceed when ready. I'm not going to self-limit or I'm not going to limit testimony, but we do have a fairly large number of bills. So as people are coming forward, if you're able to be succinct, the committee would appreciate that so we can get to everybody's bills. You have to fill it out now. You're welcome to testify, and then you can fill it out later. No big deal.
All right.
Thanks.
Thank you for having me here today. My name is Christina Juarez, and I'm from Kansas City. I, as well, was not familiar with this situation, and 3 years ago, my sister passed away and had children. So I took custody of her children and applied for them to receive survivor benefits. I was named their representative payee, and in the process of me trying to gain custody, I had to become a licensed foster parent, my family. And so we did that. In that process, they decided that we would receive a foster care subsidy. And within 1 month, the state of Missouri had requested to become the rep payee of the girls' survivor benefits. So if, just an example, say they were receiving $600 each a month, they took that and gave us a $400 a month subsidy, okay? So, and they have what is called the kids account. That's what they call that. The record keeping is questionable. They promised that I would receive those records of disbursements. I never did. I was told that this was going to be a safety net for children that are often taken from or mishandled finances by people that are taking care of them. So we were happy to go ahead and allow that if it was going to be a savings account, as our goal was guardianship, and we would get that soon. Ruby turned 18, and right before that we became guardians, or we out of foster care, and we expected to receive the funds because that's what we were told, okay? Ruby was a senior in high school. She was working a job. She had no vehicle. So we were pretty excited. It would have been about $8,000 per student, and that would have helped. She had already been accepted to live on campus and start her MSW at Park University, and she needed a vehicle. About $8,000 would have been perfect. We received a check for $900, and she was devastated. So I reached out to Children's Division, and I said, this is crazy. To my account, it should be more like $8,000. And they said that in the case of Ruby and Hartley, that they use the Social Security survivor benefits to pay the $400 a month allotment that we received, the foster care subsidy, and that the $900 that we received was the leftover portion from what wasn't paid to us. So essentially, Ruby and Hartley paid for their foster care subsidy from their own survivor benefits from their mother, leaving them destitute at 18. We did support her and still do, and her sister, I still have custody of her, and she's 15. But if we are going to look at children coming out of the system, and we're going to talk about poverty, and we're going to talk about success, and all the money that we do still have systems that we pour dollars into for these people when they leave the system, but we take this small amount of money that could help them be successful, carry a job, not need these extra subsidies, not need food stamps, or possibly Medicaid if they're working. They can get health benefits at their jobs. They can be successful in college like she is doing right now. So I'm here to totally support that. I think it's very sad that these children had to pay for their foster care benefits. There is a very murky waters on this. I actually took a job with Children's Division to figure out after this. I was so upset, and I went and rogue and tried to figure out the system. There are other children that live in the foster care system that live in state-funded housing, okay? They receive a lot of benefits, the same benefits that Ruby and Hartley received, even more benefits. They receive all year-round food stamps. They receive other care. There's other opportunities that those children receive, and every month a worker comes and spends their survivor benefits or their Social Security benefits on their clothing, bras, glasses, extra sunglasses for prescription, contact lenses, things that the state doesn't cover with Medicaid that people want and need. And Ruby and Hartley didn't have that opportunity, and they never will. That's gone. It's over. So I'm here to support these children having a successful life and being treated fairly.
Thank you for your testimony. I'm so sorry for your loss.
Thank you.
Any questions for this witness? Thank you for being here today. Anyone else here and testify in support?
Madam Chair, members of the committee, Alex Eaton testifying today on behalf of the Center for Rights of Abused Children. We appreciate Senator Rehder bringing this bill forward. I think the previous witness obviously gave a real-life example. I sent around, I emailed the committee an op-ed from another child that at 11 years old lost his mother, and his father was arrested. At 11, he should have received, his mother served in the Navy, and through those military veteran benefits should have received around $1,000 a month. When he turned 18, realized those funds were being used by the state and received $0. So I think that's, obviously these are real life examples. One key piece here is in 2020, there were close to 42 states that had around $250 million in veteran or in benefits that were being used by the state, and that represents, federal benefits represents roughly 3% of benefits to foster children. But I think my example and the previous witness can show that even a small amount goes a long way, and these children should not be paying for themselves. So I'm happy to take any questions and can provide any data, but again, appreciate this committee.
Thank you so much for your testimony. Any questions for this witness? Seeing none. Anyone else here in support?
Madam Chair, Jorgen Schlemeyer, just quickly to go on record for the Missouri Coalition for Children in support of the bill.
Any questions for this witness? Thank you, sir. Anyone else here in support?
Hi, Madam Chair and members of the committee. My name is Madison Ekrit, and I'm here as a registered lobbyist on behalf of Foster Adopt Connect. And I want to thank the committee for hearing this bill, and thank you for bringing this forward. It is so important. One of the reasons why we are behind this bill is from hearing from other foster families, one in particular who wanted to be here, but we will be sending his testimony to you all. Just to give some more context, I really appreciate the personal testimonies that were shared. Approximately 5% of children in the foster system are entitled to these benefits, which can amount to over $900 per month. And currently, the vast majority of foster youth, especially those in Missouri, do not see a dollar of those benefits and do not even know that the division has applied for them. And that has been the decades-long common practice for most states, and to reimburse themselves for the cost of the child's foster care using the federal benefits that they would otherwise be covering for other foster children. And since 2018, about 15 states have enacted changes relative to this, and there's been different approaches and a variety of impacts, but this bill includes the best practices that have emerged since then, which memorialize the requirement to screen and apply for benefits, which the division should be doing, and to memorialize the notice requirements, which they should be doing, but I think in practice what we've been hearing is that's not always the case, and quite often that's not the case. And that the state may not use the benefits and assets of a child to offset the standard costs of their care, that they may be able to use this for needs that go above and beyond the standard care. And that the money is saved in a way that doesn't jeopardize the asset limits for other benefit programs, as survivor benefits don't have asset caps. And this bill allows funds to be saved in an ABLE account that would do so. As we said, that foster youth have no obligation to pay for their own care, and this can be a difference maker for their success outside of the system. Just a couple of statistics that the average SSI disability benefit is around $10,000, which can equate to 2 years of books and supplies for college, 10 months of rent for a one-bedroom, and 9 to 12 months of care for a young child, or 4 years of SNAP benefits. So this money can be applied to make significant changes in foster youth's lives as they age out of the system.
Thank you so much for your testimony. Any questions for this witness? Anyone else in support?
Good morning. I'm Robin Schulp. I'm Director of Policy and Advocacy with Kids Win Missouri, and we just want to go on record in support of this and thank the sponsor for bringing this forward.
Thank you so much. Any questions for Michelle? Anyone else here in testify in support? Anyone here in opposition? Is there anyone here for informational purposes only? Seeing none, that concludes our hearing on Senate Bill 862. Senator Thompson Rehder, would you like to stay in your seat and introduce Senate Bill 863?
I would, and I really appreciate you, Madam Chair, doing these bills back to back like this. So this bill is incredibly simple, and it's one that I thought that we had already fixed several years ago. For those of us who served with Representative Cora Faith Walker, we remember that one of the things that she was incredibly passionate about was making sure that our folks, our parents that were on medication-assisted treatment, that they did not have that against them when having reunification with their children. And so let me back up for just a second and explain something about medication-assisted treatment. So medication-assisted treatment is something like Suboxone or methadone or some of these other treatments that when folks have substance use disorder and it is a neurological disease, some of our DNA is more susceptible to addiction. That's been scientifically and medically proven for over a decade, maybe over 2 decades at this point. But when someone has that, the medication-assisted treatment does not get them high. It keeps them level. So if you have had years of addiction and you are now on medication-assisted treatment, say Suboxone, to keep you level, meaning not keeps your body from getting sick because you've jacked up the dopamine reward system in your brain. That's how it works. You've injured your pathways in your brain. They have started redirecting. So I liken this to if someone has been a smoker for 30 years and they have now started having heart problems because of the plaque buildup, because of all the things that smoking can cause for heart issues, and they have to go on heart medication. We would never say, you can't have your kids back until you're off of this heart medication. You did this to yourself. But no one would say you being on this medication is a problem. Our court system is saying that in some areas. So I thought we had this fixed several years ago with Representative Corfaith's bill. However, I was speaking at a conference in Kansas City this past summer, and a worker in our juvenile system, or in our children's division, I'm sorry, came up and spoke to me, and she said that she had several mothers that had been through, that had walked through all of the process of getting their children back, but since they were still on medication-assisted treatment, the judge would not allow them to have their children back. So their children are in the foster system and not with that parent who has gotten a job, who has gotten clean, who is having absolutely every single box checked that they were required to check to get their child back. But because they are on maintenance medication for the damage that their years of use had done to their body, the judge is preventing them from having their children back in their home. I don't need to explain to this committee how damaging that is to these children. So my bill, at that moment I reached out to Senate Research and I said, okay, I thought we fixed this. And they said, well, it was kind of a gray area. It's not an absolute. And so our wonderful researcher has put this together for me that would be very absolute in saying that this cannot be a reason that children are not reunified with their parents. So with that, I'm happy to take. I don't know that we have anyone here to testify. This is something that I just uncovered, and maybe a lot of folks don't think about it, but I'm happy to answer any questions.
I have a couple quick questions. It looks like you're opening up a couple sections of the code. Is this only in child abuse and neglect courts, or is this including in custody battles?
This is,
and we can talk offline.
We will need to talk offline because I'll need to bring in our researcher and.
Okay, those are the two spots at which the courts can have impact and placement for children for both dissolution and parental custody cases, along with child abuse and neglect.
Gotcha. Okay. Let's do chat about that.
Okay, great. Senator Carter, it looked like you might have a question.
I had a similar question, and so we can just talk offline. Thank you.
Thank you.
Any other questions for the senator? Thank you very much. Anyone here to testify in support? Anyone here to testify in opposition? Anyone here for informational purposes only? Senator, this is my very favorite type of bill, is the bill when there is a problem that has been identified and a solution that has been brought forward, and it is not coming from anybody bringing the legislation to us. So thank you for trying to solve a problem. I look forward to talking offline. That concludes our hearing on Senate Bill 863. We're going to move to Senate Bill 813, Senator Thompson Rehder, would you mind taking the chair again?
Thank you. We will now hear Senate Bill 813. Madam Chairwoman, we are ready when you are.
Thank you, members of the committee. Thank you, Madam Chairwoman. This is Senate Bill 813. I'm Mary Elizabeth Coleman, representing the 22nd Senatorial District. And this bill should look familiar to the committee. It's a bill that we voted out of the floor, not just out of committee, but off the floor last year. Senate Bill 813 is designed to reduce redundancy and paperwork for assisted living facilities in the state of Missouri while maintaining the highest level of care for those in need. It is really a pretty basic bill. It's letting the Joint Commission, which is a nationally recognized and focused on continuous improvement of healthcare for the public, in collaboration with other stakeholders by evaluating healthcare organizations providing safe and effective care in the highest quality and value to accredit Missouri assisted living facilities. It would also allow any other national organization that meets the same or similar requirements to be able to check the box for that Chapter 198. Chapter 198 has incredibly important provisions in place to make sure that people in assisted living are safe. There are organizations that assist with that. This would not be replacing the requirements that the state has. It would be eliminating duplication so that if you are nationally accredited, you are also accredited for the state. It does not reduce or lower any standards. It simply allows for an assisted living facility that has gone through the process of accreditation to not have to have additional state accreditation. Nothing will reduce the quality of care. And I have witnesses who are here that will be able to testify as to what those inspection periods are, what the hotlines are for when you call somebody, when anybody sees something, what the ongoing requirements are. We are in no way reducing or harming the care of our residents. That has to be the utmost priority. And in fact, we have seen some really horrific things that have come out of the closure of some facilities in the state recently. And so it is very, very important to understand that this is in no way eliminating the requirements that are on the books, and we're going to be having continuing conversations, I think, about making sure that residents are safe. This is merely a paperwork bill. So with that, I'm happy to take any questions.
Thank you. Senator Washington.
That's okay.
If we served together in the House, all of us, and then
All
came
of us,
over to the Senate, do we get to just call each other lady sometimes accidentally?
Real quick, you said it's not taking anything away, but it is taking the requirement, if you are accredited, of having an annual inspection by our department, correct?
It allows the inspection that's happening for the accreditation to qualify for ours. That's right.
Okay. So I love the bill, don't get me wrong. However, I get leery when we say any accrediting agency.
I'm happy to work with you on that language. Then,
Okay,
so we
yeah,
can
because
tighten that
I
up.
need
That's
it to
fair.
be something that's actually, something that's recognized and that sort of thing.
Of course,
And then
Senator,
I'd like
yeah,
to work with you
100%.
also on how we, this just happened yesterday. Some people came in my office and they were workers. And they are getting, and we know that sometimes our elderly get excited and use their hands against the workers. And so I'd like to work with you and maybe Miss Strawn also, because she had visible scars that the worker did because of that. And they have made multiple complaints to this facility, and there are apparently multiple people. And so like, say if that facility was accredited by whoever, I don't think they should properly be able to be excluded, because it's clear they have some other issues in there. Because what's going to happen is somebody's going to get tired of getting beat up if nothing has been done, and they may, we're not paying, these are not people that we're paying a
Right.
lot of money.
No, we need to make sure our residents and the workers are safe in facilities across the state. So happy to
Okay.
have those conversations.
Okay, thanks.
Thank you, Senator.
Anyone else have questions for Chairwoman? Seeing none. Anyone wishing to testify in favor, please come forward. Be sure to leave a witness form and proceed when ready.
Good morning. My name is Sarah Klebold. I'm General Counsel for Arrow Senior Living Management. We manage 33 assisted living communities in the Midwest. 15 of those are in Missouri. Some are in the districts of this committee. This bill targets just assisted living. Arrow does not do anything with skilled nursing or nursing homes. That is much more heavily regulated due to the level of care needed for those residents. So again, we're talking only on assisted living. And I wanted to take a second just to talk about the different types of surveys. There is the annual survey, which is what is at issue in this bill. So basically, if a community is accredited by the Joint Commission, you wouldn't have to go through that annual, quote, re-inspection that would be on the Joint Commission or the recognized accrediting entities basis. But there are also complaint surveys. So for residents or families or anybody who complains, the state does come in, we'll look at that, check policies, procedures, training, everything to make sure that the communities are operating according to regulation. There's also what we call self-reports. So under the regulations, if certain type of incidents like a resident to resident or resident to staff happen, those get reported, and state also comes in to look at those to make sure the proper standards are in place. So this bill doesn't mean that the state loses oversight or does not have any ability to come into the communities to check on things. It simply just reduces the administrative burden for those communities who have gone through the accrediting process, who has much higher standards than the state of Missouri. Just two more points I'd like to make. This isn't a new concept to Missouri. There's similar type language in Chapter 197 that deals with hospitals, hospice, and home health. So in those provisions, they allow reports or accreditation from recognized accrediting entities to basically substitute for the annual state inspection. So it isn't a new concept to Missouri. This isn't also the first state that would be doing this. There are several other states that have similar type regulations. Those states include Arizona, Iowa, Georgia, Nebraska, and New Jersey recently adopted a change to their regulations. We believe this is really important to us. We take accreditation very seriously. We have currently 11 communities that are accredited both in assisted living and with the memory care certification, and our goal is to have the remaining of our communities across our portfolio completed by the end of 2024. So we think this is a very important issue. Thank you.
Thank you so much. Do we have anyone wishing?
That's one quick
Senator
question.
Washington.
Thank you. I know that I serve on a community college board, so I know the cumbersomeness of getting prepared for an evaluation or an inspection or whatever, so I know that to do that twice or whatever. My question is, if we pass this bill, the accrediting agency, will they conduct a review every year? Or, see, like for us in the community college world, it's just every 3 years. So will the facility still have to answer to someone, whether it's their accrediting agency or the state, every year?
The actual accreditation process is every 3 years, but we do have ongoing reporting and compliance obligations. So each month we have to submit certain data on various topics, including falls, staffing stability, use of certain types of drugs, and what the Joint Commission is looking for are trends or any declines. And then they can always come back in, re-inspect. You can drop the accreditation if they think that the community is not performing. So there is ongoing touch points with the Joint Commission.
Okay, I'd probably like to talk to Senator about that, only because even at my own school, that 3 years put a really big lack in our LPN program because it should have been checked earlier. And so we lost to about 2.5 years because they didn't come back and look at that. And so we should have lost accreditation, to be honest, earlier than we did. And so that kind of left, and I'm just saying students, like if it would be the residents, it left them out there going to an unaccredited school, and then they weren't able to take their nursing exams or whatever. So I'll work with Senator on how we can figure that out, because I think this is a more vulnerable population, and I appreciate it. I know how much paperwork you guys go through and all of that stuff, but I don't want to take this from 1 year to 3 years and we're missing something.
Yeah, so just a couple points. I'm also happy to talk with you or even have the Joint Commission talk to you about the ongoing reporting and compliance requirements that they have for the program. So again, it's not just 3 years and we never hear from them again. And I do want to stress again, the state still has oversight. The Department of Health and Senior Services still has oversight. So you still have those complaint surveys, you still have self-reports, which I don't want to say they happen frequently, but the state is in the building on a somewhat regular basis to identify any issues. And so if there are any concerns, I do think those would be addressed through the state too. They don't lose their oversight powers.
Any other questions for this witness? Seeing none.
Thank you so
Thank
much.
you so much. Anyone else wishing to testify in favor, please come forward. Be sure to leave a witness form. Thank you. Proceed when ready.
Thank you, Madam Chair, members of the committee. Nikki Strong, here on behalf of the Missouri Healthcare Association to testify in support of the bill. I think the previous witness did a great job explaining the bill. Just want to again be clear that this only applies to assisted living and residential care facilities. It would not apply to skilled nursing facilities. We don't have the option to apply to that type of accreditation, so that wouldn't apply to them. And then just want to further reiterate the complaint process, whether it be a self-report or a family member or even a resident in a facility, has the ability to report any issues, and the state is mandated to come in and investigate those reports within a certain time frame, typically 24 hours. So we think this is a good bill. I know that the accreditation is a very tough accreditation to achieve. When we quizzed our members, they were very aware of it. So I think the number of folks that actually apply for this accreditation speaks to the challenge of actually getting the accreditation. So happy to answer any questions.
Thank you. Do we have any questions for this witness? Seeing none, thank you so much. Anyone else wishing to testify in favor, please come forward. Anyone wishing to testify against?
Madam Chair, members of the committee, my name is Ron Berry. I'm here as a registered lobbyist on behalf of SEIU, the Services Employee International Union. Our healthcare workers are very concerned about any idea of a decrease in surveys or inspections. We're seeing a lot of backlog inspections, whether it be residential facilities, nursing homes, or some of our other care facilities. So we just want to be on the record in opposition.
Thank you. Do we have any questions for this witness? Proceed.
So if you were to work with the carrier of the bill and Senator Washington, making sure that those were yearly inspections, would you be okay with the bill?
We would be happy to entertain conversations, absolutely.
Yeah, okay.
Any other questions for this witness? Seeing none?
Thank you.
Thank you.
We're against each other on everything this year. It's kind of fun.
Oh, that's not true, Senator. That's not true.
Almost.
If you don't mind, Senator, proceed.
Now, reiterate again, repeat what's the objection again?
If you look at the number of inspections, whether it's a nursing home, a residential care facility, or whatever type of facility that we're talking about today, and I am to some degree lumping these together, but the state is in a big backlog on the inspections. We have not had the number of inspections. Even there are some of inspections that have been called, but on the annual inspections, we are very, very behind. Part of that is the lack of staff and the lack of contractors to perform these inspections.
So wouldn't this actually kind of help if they've already been inspected?
But they
by
haven't been
their,
inspected,
no,
Senator.
No,
They're
I'm not.
not.
Let me finish my
Yes,
question,
ma'am.
please. I love you, but we don't want to go there. If there's an accrediting agency that's already inspected them, wouldn't that kind of help with the backlog? I'm not saying they have inspected them. I'm saying, if I go to AAA accreditation, whatever, it's the best accreditation organization in the nation or whatever, and I am accredited through that organization, which included a very thorough inspection, possibly more thorough than what the state would actually do. Wouldn't that be okay, or wouldn't that even help with the backlogs?
So again, our concern, just as Senator Coleman mentioned this morning, there was a nursing home that failed just recently, and part of the failure, we believe, is that it had not had its regular inspection. So we're talking about an annual inspection. There are a number of different inspections that are required by the state and the federal government, especially for those facilities that are receiving Medicaid. They have, we can look at differences here, but we are concerned about the lack of inspections and that this could possibly advance that
So could
continued
you
practice.
ask your members, like maybe, I'm just throwing this out here as a way to try to compromise, since maybe the accrediting agency inspects every 3 years, that at least that year could be eliminated by the state. So I don't know if you know how much goes into accreditation. I can imagine it is significant because we're on a community college level and we go through multiple accreditations for every single program we have. And then we go through a larger accreditation just to be a community college system. So we have to go through one for our health. We have to go through one for every degree program we have. And it's a lot of work. And I would imagine when you're including real people, that it's a lot of work. And so to have them have to go through that every year, if you could find some numbers where the lack of it, why that is bad, I would love to have that conversation with you and Senator Coleman as well, because I am concerned that we don't, that this would eliminate it every year, but also I like not putting so much burden on those nursing facilities that are doing a good job. Thank you.
Thank you. Do we have any other questions?
Just a clarifying question. Tell me
Proceed.
the two things. One was the inspections. What was the other concern that you had?
So inspections and surveys are basically the same thing.
All right.
Thank you so much.
Thank you, ma'am.
Do you have anyone else wishing to testify against? Anyone for informational, against?
Madam Chair, members of the committee, my name is Jay Hardenbrook. I'm the Advocacy Director for AARP here in the state of Missouri. I want to say that we definitely want to encourage more facilities to become accredited. That is absolutely essential, and we should figure out ways to do that. Taking away oversight, especially in a year when we saw the largest long-term care facility in the state shut down because the state didn't do adequate oversight, this bill, I think, is just really poorly timed. We should be looking at ways where we can have more oversight of the industry, because obviously there was some financial malfeasance that has been going on, and if it is at that level, we know that there are a lot of other things trailing down from that we as a state are not paying attention to. The nice thing about everybody being on the same playing field for this, first of all, if you've gone through accreditation, as Senator Washington pointed out, you already have everything in line. I like to say we shouldn't have another inspection when they've gone above and beyond to get that accreditation done. I think finding some other incentive for them would be definitely worthwhile, but we are very much opposed to reducing any sort of oversight to long-term care facilities, especially in the environment that we're in right now.
Just to be clear, so you're saying long-term care, this is
Yep.
assisted living?
Right, so it's not
there's a-
skilled nursing, but we tend to put long-term care under that whole, so memory care is obviously long-term care, right? I mean,
But the bill is only for
assisted living. So, I mean, memory care is
So
attached to
was
assisted living.
the place that was shut down that you're talking about, was that assisted living?
was
Would it
not.
have fallen under this bill?
It would not have, but residential care facilities do provide very intensive care, oftentimes for people with severe mental illness. Like this is.
So you're opposed to
say
this happening to the long-term care places, so
all,
not
all
the
of them.
assisted?
All of them. Assisted living falls under long-term care, even in law.
Gotcha,
So
but the ones that had the problem wasn't assisted care?
it was not an assisted living, but this also covers residential care facilities, just to make sure everyone is aware. It is not just assisted living. And assisted living
The
is at a-
senator's bill is not just assisted living?
Correct. That is
Senator, is your bill assisted living, or does it cover? I'm
My understanding
confused.
is that it's residential care, and so there has already been some changes previously made to residential care that has not been made to assisted living. So this is trying to bring them in line. So when you bring it in line, it's going to apply to both residential care. But right
Thank
now, the existing law is only for part of it, and so it's making all residential care, both assisted living as well.
Thank you. Okay.
Does that make sense?
I was
so
confused.
so
Yes, I
and it is
missed that.
confusing because again, AARP uses language that's different than the licensing provisions use, and so
And the state uses.
and the state uses a third
Yeah.
set of language, and so you almost need a dictionary to figure out what we're all talking about.
Right.
But I'm now
But the
feeling
one
I'm
that was shut
testifying
down was
when
not
he's
one that would
testifying,
fall.
so I'm going to pass.
Okay. That's okay, Senator. I'm
Got it.
happy to pass the microphone.
But the one
anytime.
that, I just want to be sure that the one that was
And
shut
you're on
down
committee.
that has been mentioned is not
That
going
was
to be affected
that was
by
a
these
skilled,
changes.
Yes, that was
Okay,
a skilled
thank you.
nursing facility.
I just want to
That
be
is
sure
correct.
that those listening and everyone in the
Yeah.
room gets this bill does not affect why that.
Correct.
It wouldn't have allowed that home to circumvent.
Right. I think my point is that at this point we should be talking about how we do better oversight of these facilities, and instead we're talking about reducing oversight on them, and that it leaves a bad taste in one's mouth.
Do we have questions for this witness? Seeing
Thank you
none.
so much.
Thank you.
I would disagree with the consideration.
Anyone wishing to testify against? Proceed when you're ready.
Sorry, Senator, I apologize. I have an 11 o'clock meeting in my office that I have to excuse myself for. Is that exceptionally rude, or do you mind?
We do not mind, but do you have a closing comment that you would like to? Okay.
No, thank you very much, Senator.
We will finish and see you on the floor.
Madam Chair, members of the committee, my name is Nicole Lynch. I'm the policy director for Voice. Voice is a long-term care resident advocacy organization, and we are in support of anything that's in the best interest of the residents. Unfortunately, this piece of legislation is not in support of the residents. Waiving the survey process for 3 years is very concerning. One of the most critical pieces to a survey is the hands-on going in and putting eyes on the resident. That is a really important piece to this, and this completely waives that. Also, we don't know if they were to be certified for 3 years and then be another 3 years, that's 6 years without a survey. What about another 3 years? That's 9 years without a survey. Another thing concerning is that this is coming from a for-profit management company that owns facilities in 6 other states. It's coming in and saying, hey, state, don't worry about us. We're so good. You don't even need to come do a survey because we're so good. And that's not the reality that we're seeing in nursing homes, in assisted living, in residential care. That's not the reality. Another concerning piece to this is that currently state surveys are public information. They're posted on state website, and there would not be transparency of data if we were to take this route. So I'll take any questions.
Do we have any questions for this witness? Senator Washington, proceed.
Does this legislation, if passed in any way, stop DHSS or the state from coming in to evaluate or visit a facility in the event that there's a complaint or anything of that nature?
No, so if there's a complaint, DSS can still enter the facility. One of the issues, though, is that residents in these facilities, while it is assisted living, are not always capable of making complaints and speaking for themselves. Oftentimes, people who enter assisted living will stay there until the day they die. And quite frankly, the company will keep them there as long as they're paying. And so assisted living more and more often has memory care units that they are now putting into assisted living, and so you can just transition over, which is honestly great for the resident that they're not leaving that facility, that they're not having to transition environments. But it is very concerning when you have residents that have a high acuity level that cannot advocate for themselves, and now we're removing government oversight in the survey process.
Well, can we agree that the residents would not be the only people that would file complaints? Maybe their family members, or like I had folks in my office yesterday that were workers, they also could file complaints?
Right, they could. That is correct. But again, not all residents have family members.
And then my last question is, will this legislation in any way stop DHSS from coming in whenever they want to anyway?
I mean, no, but they don't do that because they're so behind and so busy and short-staffed that they're not going to make an appearance without a complaint. I mean, we have a hard enough time getting them to come, DRL to come do surveys to investigate complaints as is, so they're not going to show up to a facility that hasn't had a complaint.
Okay, thank you. And thank you for being here.
Do we have any other questions for this witness? Seeing none, thank you.
Thank
Please
you.
leave your witness form. Anyone else wishing to testify against? Anyone for informational purposes only? Seeing none, this concludes our hearing on Senate Bill 813. We will now hear Senate Bill 779. Senator Eslinger, we are ready when you are. I see that superintendent coming out in you. Let's get this fixed. I'm going to tidy this desk up.
Good morning. Good morning, Madam Chair. For the board, Senator Carly Eslinger, representing the 33rd Senatorial District. Senate Bill 779 would establish the Counter Human Trafficking Task Force led by our Attorney General. According to the National Human Trafficking Hotline, in 2021, they identified over 10,000 cases throughout our nation, with over 16,700 victims identified. The National Human Trafficking Hotline categories these situations, these cases, as sex trafficking and labor trafficking. 7,500 of these were instances of sex trafficking, and there were over 1,000 and probably more of instances of labor trafficking, and in several cases, over 400, they're both, where they are trafficking labor as well as sex trafficking. Senate Bill 779 would take a step forward in combating human trafficking in Missouri by assembling the Counter Human Trafficking Task Force. This task force would have representatives from the major departments that could provide relevant information and resources to help combat human trafficking. Including on this task force would be representation from the Mental Health, Missouri State Highway Patrol, the Department of Public Safety, the Office of Prosecution Services, 3 members appointed by the governor, members of the legislature, and led by the Attorney General. This task force would provide an accurate picture of what is actually happening in Missouri. And my office has also been contacted by this approach by the Supreme Court to work on language to include, which would be in a sub, a judge appointed by the Chief Justice of the Supreme Court to ensure that our judicial system is also engaged. While we know that Senate Bill 779 will not deliver the silver bullet to end human trafficking, it is a critical first step in identifying what is happening in our state, the resources we need to allocate, and what we can do to better protect our citizens. With that, I'll be happy to answer any questions.
Thank you so much, Senator. Do we have questions for Senator Arthur?
Hello, thank you for your legislation. I was curious, how did you identify the people who would serve on the task force?
There are folks that currently would be able to provide resources or information regarding this issue, so such as public safety or mental health, or the people that currently sometimes have to deal with the issue, but also have resources and information on how we can possibly solve the issue. Okay. And of course, open. If there's another group that we may have overlooked, would be glad to bring them in.
Okay, great to know. And I hope that there would also be like geographical diversity and all of those things reflected in this as
That's
well.
a good point. Yes, thank you, Senator.
Thank you.
The task force, or not a task force, the commission that we did this past year, and we put together folks from all of, it was multidisciplinary commission, and I was on it as well, and we went through all of the different corners of the state and had people testify and pulled together. And the list of who all is to be on it was kind of mirrored from what was found in that. And this important task force that the senator's working on, it does pull together, because what we found is we had different things happening and no one was talking to each other. And her legislation makes a central unit.
Yes.
To fight, to pull all of them together, to have a central spot, a central task force that is really the champion of keeping everyone informed and finding all of the problems. And
Yes. And this legislation also includes that the task force will submit a report to the governor and General Assembly on or before October 31st of each year. So there is an opportunity for them to be able to report status and what's being done to help solve the problem.
That's fantastic. Thank you. Any other questions? Senator Washington? Do we have anyone wishing to testify in favor? Please come forward. Be sure to leave a witness form.
Good morning. Madam Chair, members of the committee, Scott Swain representing the Missouri Police Chiefs Association, as well as the Alliance Against Gateway Human Trafficking based in St. Louis. We're a nonprofit that actually goes around and teaches law enforcement, hospitals, school districts what to look for. Key things to look for. We've been involved in a number of task forces, and at first blush, it takes me back to when you all created a task force that looked at task forces, like we've had enough of them. But of all the task forces to look at, this is probably the most paramount. And so we certainly want to thank the sponsor and all of you for these efforts, and anything we can do to help, we're right there. So thank you.
Thank you. I concur. I appreciate her doing this. Any questions for this witness? Seeing none. Anyone else wishing to testify in favor?
Morning. My name is Jessica Seitz, and I'm the Executive Director of Missouri Kids First. My organization is the State Association of Child Advocacy Centers, and I was actually pleased to be the unappointed member on the council that Senator Rehder referred to. I had to write it down. We love a long name on task force. So, Statewide Council on Sex Trafficking and the Sexual Exploitation of Children. So, woo. That council was set up by the legislature in 2022 in legislation that the chairwoman carried, and it met throughout 2022 and 2023. It culminated with a report that was issued the very end, like December 31st, and I'm happy to send that report around. We found a lot of things of importance in the process of those meetings. We looked at data. There was very inconsistent data collection on the prevalence of child sex trafficking. Very inconsistent response. There were advocacy groups around the state that weren't working together. I mean, that's hence the need for a statewide council. And we came up with some great recommendations, some of which, believe it or not, we're already implementing. My own agency has started a statewide CSEC. CSEC is the Commercial Sexual Exploitation of Children. We have started a statewide program in partnership with 4 of my child advocacy centers. And the work is ongoing. And so I say all of that, and I'm happy to go through everything we did if you want to. But we got a lot done. All that's detailed in the report. But one of the findings that we had is that we weren't done yet. And so, and that this work, there was no other place that these same stakeholders were coming together after this is over. So public safety, mental health, all the folks that are on here. So everybody that has a stake in the investigation and investigation of trafficking, but also the support of victims, there wasn't like a statewide convener, which limits the ability to make systemic change. And so we were pleased. One of the recommendations that came out of that task force was to hold this under the auspices of the Attorney General. So you see that in Senator Eslinger's bill. You'll see that it's been in 3 other bills that are before this body this year. So you may hear me say this again in another hearing. I would just say that we might want to align some of the language that's in some of the other bills. It adds, I think, there's a version that does have a member of the judiciary on it, and expand it to be clear that it's adults and kids, and then potentially allow for subcommittees. So I could talk about task forces all day, but we're very happy to see this work continue, which is why we're here in support of the bill. Thank you for Senator Eslinger for carrying it. I'm here for any questions.
Any questions for this witness? Seeing none, thank you. Anyone else wishing to testify in favor? Anyone wishing to testify against? Anyone wishing to testify for informational purposes only? Thank you, Senator, for doing this. Excellent bill.
Absolutely. Thank you for all for the time to hear the bill. Appreciate it.
This concludes our hearing on health and welfare. Thank you.